One interesting caveat about this is that this isn't really like detailed contracting like that. It's more like you have like agreements and understandings with people. Yes, it should be written down, but it's not like a contract where everybody signs and you're held to terms in this way, because during an emergency, that pharmacy might be like burned down or flooded or whatever. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about vendors you need for your emergency management plan. But first, if you like our content, please like, share, and subscribe. So let's get started. As you know, in Home Health and Hospice, you're going to need various contracts with vendors. Separately from those day-to-day contracts that you need, you also need to make agreements with certain vendors that are for your specific emergency operations plan. You could use vendors that you use in your day-to-day life. That's perfectly acceptable and probably a good idea. But this list is specific to reacting to an emergency. First and foremost, for each vendor on this list, you're going to need their company name, the name of the contact that you are speaking with, the phone, address, email, and the date of the initiating conversation with each vendor. These are actually written into the emergency management plan, either within the actual body of the plan or as some kind of addendum, but they need to be definitely worked on. Depending on your accreditor and COP, this kind of covers all of the accreditor requirements and the COPs as well. So let's get started. The very first vendor we're going to talk about is a pharmacy. So the idea is that in the case of an emergency, a patient's pharmacy might be like burned down, right? Or like not accessible due to flood or, whatever the emergency is. And so you want to have a pharmacy that's a little bit like outside of the area. And of course, if you have a couple of different pharmacies, so that in the case of an emergency, they can step in and fill any required and emergency prescriptions. You might even have situations where the patient is immediately evacuated and all of their medications are like left in the house and burned down with the house, or whatever, like just no longer usable. So you really want to have a pharmacy or multiple pharmacies on hand that can serve as a backup for any kind of this like we need medications quick situations. Now, the understanding that you need to have with this pharmacy, these are one interesting caveat about this is that this isn't really like detailed contracting like that. It's more like you have like agreements and understandings with people. Yes, it should be written down, but it's not like a contract where everybody signs and you're held to terms in this way, because during an emergency, that pharmacy might be like burned down or flooded or whatever. Or like, God forbid, like the owner dies or the whatever. They might also be not available. But the point is, the understanding is that you have some kind of payment information on file. So like a credit card or something like that. And if there are any emergency medications needed, of course, with a doctor's referral or a doctor's prescription, that pharmacy will quickly fill the prescription without fumbling through payment stuff. Oh, this patient qualifies or doesn't qualify. It's kind of like you just are able to quickly process this stuff. The next kind of vendor is a medical supply company. So it's the same kind of idea. The idea is if the patient quickly evacuates somewhere, for example, and now in their new location, they don't have like grab bars or, whatever it is that they might need from their medical supply company. And they weren't able to like uninstall them from their house before they left. So you want to work with a medical supply company that, in the case that the patient's medical supply company is unavailable, that they can fill these orders quickly, effectively, and not leave any like care behind or neglected. The third type of vendor is a partner home health or hospice agency. So if you're a home health, it's a partner home health. If it's a hospice, it's a partner hospice. The idea is that in the case of an emergency, whatever can happen, you can transfer the patients to this other partner company. And when the emergency is over, or when your company is back on its feet and able to take care of them again, they will transfer them back. This could be all the patients, this could be a certain number of patients, this could be some patients in a specific location. Essentially, you're just reacting to this emergency in the time, but you do want some kind of partner trusted agency that you can trust to transfer the patients back whenever the time comes. The next kind of vendor that you want to have is a non-emergency medical transportation company. So pretty much with medical transportation, the point of this is if the patient needs to get evacuated and they don't have like family that's going to help them leave their location or residence, like, this happens. Sometimes you have elderly people, patients that are living by themselves. They don't really have any family. They're kind of like, loners, like not in any bad sense of the word, but just like they don't really have anybody around them. In the case of an emergency where somebody needs to get evacuated, you're going to need to help them evacuate via medical transportation, whether it's emergency or non-emergency, to a safe location. So you need to have this kind of company on file, because during an emergency is not the time to go looking for these things. Especially the internet might be down, so you're not going to be able to search as easily and so on. You really want to have these companies like, in some kind of like list ready to go, usually living in the emergency plan. The next kind of vendor is going to be your emergency medical transportation. And this is for more severe cases or cases where you need like real medical hookup in the car, things like that. A lot of people will also contact the fire department for these kinds of situations. And the idea here is, let's say an emergency has happened, the patient is in the affected area, and you're trying to contact them, you can't reach them. Like, you haven't been able to reach them, and now you're getting worried that something's happened to them. So somebody needs to go and check on the patient. However, it could be an area that is closed off to public because it's part of the emergency. Like if there's like some kind of crazy flood or like the fires that happened in the LA area recently, where whole neighborhoods were just closed off. People couldn't access their neighborhoods. So they're not just going to let some like nurse or whatever like go and try to check on the patient. You really want to have the contact information of all the local fire departments in your area, the fire stations. You can alert them of the address of the patient, and they can go physically check on the patient in a safe way, in a way that they know how to handle, that the average person doesn't know how to handle necessarily. Next, you're going to want to contract with a therapist. Usually any kind of therapist will do. And the idea is for critical stress debriefing. So if you have a field staff that's worked the emergency, for in whatever capacity, for whatever reason, or maybe even was personally affected, you want to be able to provide them like one or two sessions with a therapist to help them process through whatever trauma they may have experienced. This isn't for every staff member, like anytime it rains. It's not like that. It's more like, the whole city's flooded and like they were like stuck at the roof of their house, like, I don't know, or whatever. Things like that. But you do want to have somebody on file, again, with your payment information already there, so that they can do like a session or two with your staff. You're not expected to cover financially like 15 therapy sessions for your staff, but just like one or two, just to like get them through possibly a critical moment. That's very important. There's one more kind of vendor in quotes that we like to talk about, and that's to find a shelter that people can evacuate to. This is a Joint Commission requirement. I haven't really seen this with the other accreditors or COPs. So the reason that I feel this is a little bit outdated is we're in the Los Angeles area, and in the LA area, at least maybe in your areas, it's a little bit different. But the only shelters that really exist in LA, in California, I guess, during non-emergency times are like homeless shelters or abuse shelters, things like that. There aren't like emergency shelters during non-emergency times. But it's still good to have this information, I guess, in case, something happens and you just don't have access to the internet at the time. But typically during an emergency, shelters will pop up in response to the emergency that are equipped to handle the emergency. But still, it's good to have like a shelter to just like in your plan so that you can quickly coordinate things in case the internet's not available for like this deep research of finding like the emergency shelters that have popped up at the time. As part of our compliance program, we do try to like research those things if an area is dealing with a major emergency, not like a little tiny thing, but like a major emergency. We do try to research that stuff and send it over to all the people in those areas that are obviously part of the compliance program. And so our recommendation is find a couple of shelters, one shelter or two shelters in the area, but just know that in the time of an emergency, shelters will be established to respond to the emergency. And they'll be in random different places, usually public places or like big stadiums, things like that. So that's pretty much it for the vendors you're going to need for your emergency management plan and why you're going to need them. And pretty much all the reasons that I've explained, that's the conversations you want to have with these vendors. So that's it. This is Mariam Treystman from the Home Health Consultant. And this was emergency vendors for your emergency management plan. Again, if you like our content, please like, share, and subscribe. Thank you.